question is that the bill be agreed to. I leave the call to the member for Indi.
Thank you, Mr Deputy Speaker. Along with telecommunications, public transport, education and climate change, access to health, doctors and pharmaceuticals are some of the major issues that got me elected to this place. It gives me great pleasure today to stand and represent the people of Indi who over the last 2 months have asked me to come to this place and have their voices heard. Following the budget, I undertook a budget impact statement around Indi, and I asked the people of Indi what for them were the most concerning issues that I needed to bring to this place. And of all the issues that I mentioned above, health and access to affordable health and affordable health care was the #1 issue. It matters more than almost anything else to people in rural and regional Australia. And why not? Because without our health, what else have we got to do? It makes it so difficult to do anything else. But there's another issue that comes with health and access to health in rural Australia, and it's about being sick. If you're sick in rural and regional Australia, it becomes very expensive. It's not just a matter of going to the doctor. It's not just a matter of buying your pharmaceuticals, which we're discussing today. It's a matter of transport, getting access to the doctor, getting access to the cities where you need specialist care. But with transport comes the backfill. Who's going to do your job at home when you're no longer there? And with illness, it also comes with care. Who's going to look after you, and who's going to help you with your dependents, the other people whom you care for? And of course we've got the actual costs of drugs and doctors, and it all adds up. Mr Deputy Speaker, during the budget impact tour, I heard one particular story that brought this home to me. It was a story of 2 brothers who live 20 kilometres out of Wodonga. One of the brothers has got cancer and is being cared for by his other brother, who's a farmer. So together, once a week, they have to go to Melbourne to access the specialist care that they need. These young men in their 20s are not well off. The brother that's doing the caring is full-time caring, so he's without paid work, and the brother who's ill is obviously unable to work. So they cope with our poor public transport in north-east Victoria. Once a week they go down to Melbourne and they come back, and they spend the whole day trying to govern their lives about it. And as they spoke to me in the supermarket in the high street in Wodonga outside Coles, there are almost tears in their eyes as they tried to explain to me and have me understand the cumulative effect of what was happening in their lives. As one after another, all these extra costs were loaded on them. But the really sad thing was that they only had a limited budget, Mr Deputy Speaker. There was no way known that they had more money coming in to meet it. So it was the health costs, it was the transport costs, it was the electricity costs, it was the energy costs that were coming on over winter, and it was having to do all the other things that made their life, and they had no money left. So as they stood there, they said, "Cathy, there's probably not much you can do. You don't hold the balance of power in the government, but could you take our voices to Canberra? Could you make sure that our voices are represented?" So I'm really pleased today to be able to say on their behalf, I've brought their issue here, and I hope it's heard by my colleagues on all sides. But the final thing I want to say, Mr Deputy Speaker, it's very unusual for me to stand up in this place and agree with everything that the member for Kennedy has said. And today I say we're on the same page, Mr Katter. It's the impact on chemists and pharmacies that's going to have the most long-term impact. And I think this has to be what we call unintended consequences. There's no way known my colleagues opposite could deliberately set about destroying local businesses and taking away their profitability, which is exactly what the chemists in Wangaratta and Wodonga are saying to me will happen. So I hope it's a mistake. I hope that in the next budget we get to rectify some of this as common sense comes in. So in bringing my comments to a close, I ask my colleagues opposite, particularly those who represent rural and regional seats, to give some thought over the next months to what we need to do about this, because it's a whole lot of things that are coming together. And I particularly ask that we pay some attention to a rural and regional impact statement, so that when the next budget comes down next year, we can actually look at and understand how all these implications are going to be affected, and then we can do the action that we need to do. Thank you, Mr Deputy Speaker.